Hi everyone, welcome to another Gypsy Nurse live event. I'm Rachel Altum, the online community manager for the Gypsy Nurse, and today we will be discussing something that has been a very hot topic in our Travel Nurse Network group on Facebook. All of you have probably talked about this either with your friends or just on the group or different places, but in the mid to late 2021, there was a growing attention towards nurse staffing and travel nurses, as well as the results of the legislative efforts that ensued to limit the cost of temporary nurses. So today we are bringing on Toby Malara to dig deeper into this topic as well as discuss what happened as COVID-19 started to subside in the spring. So Toby is the Vice President of Government Affairs for the American Staffing Association, and is his role, Toby directs the ASA's government relations, lobbying, and political activities. So he definitely knows a thing or two. Before we let him take it away, I'm going to pass it over to Steve, our CEO. You haven't seen him since the virtual conference, but he is here today with us. So thank you.
Many people would say that's a good thing that they haven't seen me since the virtual
Yeah,
conference, Rachel. So,
we need to see you more.
well, it's great to be here. And Toby, thank you so much for joining us. Your timing is perfect in terms of this session because there's so much going on and so many questions in the industry. We're grateful to have an expert like yourself kind of guide the audience through some of these things that are happening right now. Before we begin, as I usually do, I have a little bit of a public service announcement to bring to our Gypsy Nurse Travel Nurse community, and this is exciting news. So the Gypsy Nurse is pleased to announce that we are partnering with the Healthcare Travel Conference, also known as TravCon, to bring registered members of the gypsynurse.com discounted attendee tickets for their fantastic live event, the Healthcare Travel Conference in Las Vegas in mid-September. I believe it's September 18th through the 21st. So the good folks at TravCon are very happy to partner with us and offer a substantial discount on attendee tickets for the show. So we're doing a little bit of a teaser here, and we're going to be giving more information over the next few days. In order to get the discount off of your tickets, you must be a registered member of the gypsynurse.com. So if you haven't gotten your member registration completed, I would highly encourage you to do so. And if you are a registered member of the gypsynurse.com, thank you, number one. And number two, be on the lookout for some exciting announcements. But I will just say this, we will be bringing this to our community next week. So stay tuned. So Toby, thank you for giving us some grace there on that public service announcement, but an important announcement for us. And again, welcome. We are grateful for your time, and I can't wait to dig into this topic because this is just something, as Rachel said, this is a very hot topic. Potential legislation and legislative issues relative to travel nursing and agencies in 2022. As we were saying earlier before we got started, your timing is impeccable because Senator Kevin Cramer from North Dakota recently introduced legislation. It's at the very beginning, but a bill called the Travel Nursing Transparency Act. In which he is talking about more transparency from agencies and facilities relative to rates for travel nursing. So this just came out, I believe, yesterday. So your timing is perfect, but welcome. And I'm wondering if you could tell people a little bit more about what your role is at the American Staffing Association.
Sure. Well, first of all, Rachel and Steve, thanks so much for inviting me to participate today. I'm really excited to talk to everybody. And for everybody listening, the one thing that we continue to learn as we go through all of the things that we've gone through this year on this issue is just, how unbelievably important nurses are and the just really incredible role that all of you fill traveling across the country to where nurses are needed, leaving your families behind, really, heroes, putting yourselves in the way, putting your lives in danger to help other people. So, we can't thank you enough for all that you do. And we really do appreciate your service. And not only for always, but especially during these past 2.5 years. So my name is Toby Malara. I'm the Vice President of Government Affairs at the American Staffing Association. We are a trade association that represents temporary staffing companies all across the spectrum, from light industrial all the way up to temporary CEOs and temporary C-suite levels, in probably one of our largest, if not our largest section, is the healthcare section of the industry. We have several members that only do healthcare staffing. We have several members that do healthcare staffing with other things. And of course, a lot of them are some of the biggest players in the game, like IA Healthcare, AMN Healthcare, Health Carousel. And so there's a lot of travel nurses that are represented by those companies as well. So we spent a lot of time over the years kind of learning about the issues that you all face and that our members face when trying to place you. And obviously, this has come to a head over the past 2 years, but specifically over the last probably 13 months. So at ASA, we have a 5-person legal team, 4 lawyers on staff. We have a chief legal officer, Stephen Dwyer, our senior counsel, Ed Lenz, who's been in the industry for over 40 years. Brady Sakata is our general counsel. And then I am the vice president of government affairs. I'm basically the lobbyist for the association. I direct the government affairs program here at the association in the federal level and in all 50 states, working with companies and chapters to try to get the message out on what a good job staffing companies do in placing workers where they're needed. And again, really no easier story to tell than talking about the valuable role that nurses play, especially these past 2 years. So that's kind of what we do here. If you're ready, Steve, I can jump into the presentation and kind of bring everybody up to speed on what we are facing and more so how we got here and what we're looking at as we go through the next kind of 6 months or so.
That would be great.
So let's just talk about where we have been and where we're going. I'm having a little trouble controlling my slides here. Let's see if I can. Oh, there we go. Okay, so how did this all start? When did this all start? So it's no surprise to any of you, certainly, that we have been dealing with a nurse shortage in this country for many, many, many years. And we have learned over the past few years that there's a lot of factors that contribute to that. It's not just as easy as saying, oh, we just need to train more nurses, because there's a lot of parts that go into place there. And one of the things that I've learned recently is that there are huge backlogs in almost every nursing school in the country, where you have many more, thousands of more applicants than positions available, because it's so hard to get nursing faculty in place, either because the schools aren't properly funded for it, the state and federal governments aren't helping out enough, and you can only accept so many students into a nursing program. We have a very good nursing program here. I'm located in Virginia. James Madison University has a kind of a renowned nursing program, and they had to turn away 10,000 applicants last year because they didn't have the faculty to support that. So we know there's a lot of issues that go into what the nursing shortage is, and obviously travel nurses play a huge role in not only helping ease the shortage, but going where the shortage may be most acute, or responding to events like natural disasters, or in this case, a pandemic. So what we started to see was back in the middle of 2020, when the pandemic was probably about 3 to 4 months old, we started to see the first signs, quite frankly, of a widespread nurses that were really just could not deal with the circumstances they were working under anymore. It was physically exhausting. It was emotionally exhausting. They were literally putting their well-being and their families' well-being in jeopardy. And so we saw a dramatic exodus from the profession of nurses at a time when we needed them most. Now, fortunately for us and for the country, a lot of those nurses stepped away from their kind of permanent jobs, or jobs working directly for facilities, and turned toward either the healthcare staffing model, some turned to the travel nurse model. And so they were able to re-enter the workforce and be that source of good that was needed without having to exhaust themselves more than they already were. And so we saw kind of a rise in not only nurse staffing, but also in travel nursing. And as the pandemic kind of subsided in the summer of 2020, what we first was kind of thought, okay, maybe we're now getting past this. We saw kind of a leveling out of the demand for nurses and what was happening. And then unfortunately, we hit 2021 when the pandemic came back. And we then hit at the end of 2021 that real crush of Omicron where everything kind of jacked back up again. And so one of the things that we started to see and we started to hear about was, okay, what's going on with these nurses? What's going on with the amount of money that's being paid to them? Because we had facilities that were saying, we are spending more on temporary nurses, whether they're per diem or travel, than we ever have before. And why is that happening? And obviously our answer was it was a supply and demand issue. Travel nurses, per diem nurses, were demanding higher salaries, and that was being met by the facilities who needed the help. Now, it didn't take long for some groups to come out and say, there needs to be something done here because we don't think things are going the way they should be. And kind of the leader of that was the American Healthcare Association, which is the national trade association for long-term care facilities and nursing homes. Part of their issue was the fact that historically, they were not large users of temporary nurses. Certainly they were not large users of travel nurses. Rarely did they use travel nurses. So they had to turn to a source of labor that they weren't used to using. And the prices were higher because of the demand and the supply that was in play. And so they thought originally, okay, something's wrong here. And the fact of the matter was, their concern was that staffing firms were engaging in price gouging. And so one of the first things they did is they went to the federal government, they went to Congress, and they said, you guys have got to do something about this. These nurse staffing firms are engaging in probably price gouging activities by driving up the rate to the facilities that are using these travel nurses. And they asked the House and Senate to send a letter to the White House urging the president to ask the Federal Trade Commission to investigate the practices of these nurse staffing agencies. And they got a Dear Colleague letter with about 195 signatures on it, bipartisan, asking the White House to do this. They also had hearings that were called by the House Energy and Commerce Committee and the Senate Commerce Committee looking into the situation. And the first thing that we learned really, as these things started to unfold, was not surprisingly and not really blaming people, but there was a tremendous amount of misinformation and misunderstanding on the role that you all play and on the role that healthcare staffing firms play. There was not an understanding of the pricing system and how it worked. There was not an understanding of who paid the travel nurses and the per diem nurses. Many of them didn't know whether you were a W-2 or 1099. So there was so much misconceptions about how the relationship worked that we as a trade association decided the first thing that we needed to do was go ahead and really kind of launch an educational campaign. We had to go out and talk to members of Congress and say, look, this is the relationship that's at play here. This is the relationship between the client, the health staffing firm, and the nurse. This is how it works. And while there is certainly a joint employer composition there, meaning both the client and the staffing firm have this relationship of being the employer for certain purposes. So for instance, the staffing firm is the employer with regards to pay, with regards to withholding for your taxes, and all sorts of other things that are going on in that sphere. They're usually in charge of training. They're in charge of finding jobs for nurses. But once the nurse goes to a facility, the facility has a role to play as well. The facility has to say to the nurse, okay, something as simple as this. Okay, Tom, just to let you know, When you go down to the third floor, the door and the exit door sticks a little bit. So you're really going to have to push it, but you have to be careful because people are coming in there all the time. So in order to not just shove the door open and knock somebody out, make sure you talk loudly and let somebody know you're coming through the door. That's like a legitimate OSHA hazard that the client needs to make sure that people are aware of. So letting people understand, especially the decision makers in Congress, what's going on with this relationship, the need that was apparent for travel nurses and temporary nurses. And that part of it wasn't that hard to understand. It was more, quite frankly, explaining to them how travel nurses were paid, what was being done for them by the staffing firm. So, for instance, if I heard this once, I heard it 1,000 times. A facility or somebody, either a state legislator or a federal legislator, would say to me, I've talked to my nurse staffing, I've talked to my nursing home back in my district, and they tell me that you're billing them $200 an hour for this nurse, and I know that nurse is getting paid $100 an hour. Therefore, staffing firm, you're making $100 an hour, and that's price gouging. That's outrageous. And so the first lesson that had to be taught to these providers and members of Congress and others were, that is a false assumption. That's just blatantly incorrect. The staffing firm collects the money from the client, pays the nurse directly, but then also pays all the withholding for the nurse, the federal and state withholding taxes, unemployment, workers' comp. They'll take benefits out of there and pay that. And then after that is done, there will be some money left for the staffing firm to take care of operational expenses and then a small profit. So finally, after doing some research, we were able to determine that 75% of the hourly rate that is charged to a facility for a temporary nurse, either travel or per diem, is what goes as the cost of labor, cost of doing business. 75% of that goes to paying the nurse and the charges associated with that nurse. And so a lot of people didn't understand that. So we were able to make some headway and were able to explain more about what the business model looked like. I met with probably 60 members of Congress and talked about this issue. And it wasn't just meeting with them to say, look, we're not doing anything wrong here. You got to back off. It wasn't that at all. It was to explain, as we talked about, what the business model was, but also to explain to them, there's a lot of issues here that you all can be more proactive in. One of the things that we push for a lot in ASA and in the travel community is more adoption on the state level of the Nurse Licensure Compact. And I know that's going to be a focus of ours in 2023 when working with state legislatures. And we'll talk about that a little bit later on today. Making it easier for nurses to go from state to state. Now, we were fortunate in a sense, if I can use the word fortunate, during the pandemic that you had, and you all know this, you had a lot of states whose governors or legislators enacted kind of emergency waivers of any kind of requirements. And so you were allowed to go from Iowa to New York without any problems, or with less problems than you would normally run into trying to go over there. But once the pandemic started to subside and those emergency powers were rescinded, those roadblocks are put back up in force. So there's a lot of education about things that the states and federal governments can do better. A lot of members of Congress we had conversations with. We talked with the Department of Labor to give them an understanding of what the business was. A lot of questions were why, it was very simple questions that you would think people could understand or just kind of intuitively know, but that's maybe not fair to ask them to do that. A lot of questions were, why would people be travel nurses in the first place? Why don't they just want to be at home and work at home? People literally did not understand that. And so there was a lot of questions about, well, why do you think that, you throw it back to them, why do you think they want to be a travel nurse? They want to be able to go different places. Maybe they want to be able to go somewhere where there is a particular need. A lot of this, again, I know I'm preaching to the choir here, but a lot of this is, life demands, right? So I have 2 high school kids that get out of school tomorrow, and then we've got the summer. Maybe it's easier for a parent who's a nurse to go work in the summertime when the kids are out of school, or maybe it's vice versa. Maybe they need to be home during the summertime when the kids are home from school, but they're more able to go out and take assignments when their kids are in school. All sorts of lifestyle choices that lead to this. So there's a lot of education. And I think on the federal side, for the most part, we were able to paint a picture that lawmakers understood. And so we were very pleased that there was no legislation that came forward looking to regulate the nurse staffing industry on the federal level. Unfortunately, the same cannot be said on the state level. This has been the largest legislative issue that ASA on the state level has ever faced in its history. And we opened up our doors back in 1966. This is an issue where we saw 14 states introduce bills to regulate the nurse staffing industry in various ways, most of them focused on either directly or indirectly limiting the amount of money that could be paid to a temporary nurse. And I'll explain that as we go through this program. But there's the 14 states that we've been dealing with this year, and we've got slides on every one, so we'll touch on them quickly. But we face legislation in California, Colorado, Connecticut, Illinois, Indiana, Iowa, Kansas, Kentucky, Louisiana, Missouri, Ohio, Oregon, Pennsylvania, and Rhode Island. Now, the real striking thing in this list to me is you have almost a 50-50 split from what I would consider to be blue states and red states. And you don't see that ever with state legislative issues. The ones that we look at in particular, it's either an issue that's driven by the red states, where they'll say, for instance, only the state can decide what level of minimum wage to be paid. You can't have localities setting their own minimum wage level. That's a very red state issue. And then you can have a very blue state issue, which would be something like paid sick leave. This issue is pretty much split between blue states and red states. And quite frankly, there are red states that were much more dug in. And you would think, or at least I thought, hey, you guys are talking about price controls and wage controls here. This is not an issue that Kansas should be considering. But it was. And I think it was because it was such an emotional issue driven by, as we talked about, a lot of misunderstanding on what the travel nurses and temporary nurses were doing and what the agencies were doing. The legislation was driven primarily by nursing homes and long-term care facilities. They made no bones about that. And we talked to the federal the federal association, the American Healthcare Association, and they just said to us, look, we have no control what our states are doing. They were taking kind of the lead on the federal side and looking for certain things, but the states were running with their own thing. And we dug into this. The first thing that we learned is that there are very different financial issues that face long-term care facilities and nursing homes and hospitals. For instance, the hospitals, by and large, got, and I'm going to use a very technical legal term here, gobs and gobs and gobs of money from the federal government. And they could put themselves in a position where they alone were driving up the price of nurses because they needed to get a certain number of nurses on shift, and they were offering outrageous pay increases to nurses, bonuses to nurses that deserved them, and then were asking for them, or it was kind of, it was spreading across the country, and the nurses were getting paid what they were asked to be paid because they deserved it and they needed to be there. The issue was the hospitals could afford it. They complained about it, they moaned about it, but it's similar to again, I've got a daughter who's wrapping up her junior year in high school and getting ready to go to college. There are people that when their kids are going to college, they literally are like, I have no idea how I'm going to pay for this. We're going to figure it out. We're going to make it work. They can only look at these places. And then there are people that have so much money, it doesn't matter. They're still going to complain about the cost of college. It's not an issue for them. And so that's kind of what the hospitals were like. They were complaining about how much money they were spending, but it didn't matter. They had the money.
So,
And so,
sorry to
sure,
interrupt you, Toby. Just a point of clarification there. When we talk about this federal money that was used to support, fighting COVID, was that money equally distributed across, private systems, public system? How was that money distributed? Because you hear a lot about the rural hospitals versus the large systems versus the city
sure.
hospitals and the for-profit. Was that money equally distributed, or did some systems receive more than others based on their status?
I think, what happened was, it's a great question, Steve. The money was given to the states to distribute as they saw fit.
Okay.
And so I think the states were the ones that were in charge of distributing the money. But what we heard kind of almost unanimously was, as you would expect, the larger systems, the urban systems got more of the resources than the rural systems did.
Okay.
You also had a situation where um, the rural healthcare facilities, whether it was the hospitals or the nursing homes and long-term care facilities, had always been seen as kind of less desirable than going to work in, a hospital in Beverly Hills, to give the most egregious example.
Right.
Um, but now these hospitals were all looking for as many nurses as possible, and so it was even harder for the rural places to attract nurses to come to them,
Yeah.
which is one of the reasons why a lot of them had to turn to travel nurses, because they had never gone that way before. They learned they could get people to come there, um, but then they soon realized that it was a system they weren't used to working. And again, it gets that point on the screen. Um, Nursing homes, we mentioned this earlier, very, very infrequently, to my knowledge, use travel nurses, except for during this COVID time.
Hmm.
And they just weren't. They didn't know what to. They didn't know what to ask. They didn't know. They didn't know what to expect. And I understand that they needed the help, but there was so much competition for the help. The nurses were in such demand that they had to do it, and the nurses were being paid. Again, it was a market driven economic decision. These nurses deserved the money they were being paid, and that's what happened. So we talk about these 14 states that introduced these bills, and we'll go through these quickly because we could spend a whole 2 hours talking about them in depth. California came up with a bill which really just kind of focused. It didn't include rate caps, and I'll get into a second what rate caps are. They were looking. So the two main issues with these bills was either transparency, and Steve mentioned that with Senator Kramer's bill yesterday. Transparency. Clients wanted to know, what am I being billed for? What am I paying for? What are the nurses getting? What is the staffing firm making? In a sense, you understand what they're asking for, but it would be the equivalent. And I'm making, again, if you ask my wife, I exaggerate all the time and make ridiculous analogies, but it'd be the equivalent of you going into Starbucks and asking for a cup of coffee, and you order your coffee, your triple latte, mocha, grande, and then say it's $6, and then you saying, okay, I want to know exactly what goes into that $6 figure. How much are you paying the baristas? How much are you paying for the coffee? How much are you paying to upkeep the machine? What's the rent of the building that you have? That's the kind of information that these facilities are looking for, because they want to see what they're paying the nurse, what the other costs are, because they want to be able to negotiate a lower rate. California, the bill's dead. Nothing happened with it because, quite frankly, the Nursing Association, which was our ally in all of these bills, the problem is that um, a lot of times they were so concerned with nurse caps that once that was taken off the table, they then kind of stepped away, and we still needed them for the fight. Um, that's very sensitive. Okay.
I was just going to, Toby, just a time check here. We're about a half hour into the session. I don't want to cut any of this great information short, but I definitely want to, because there's so many questions I think people have and questions I want to ask you. We may just want to move through these. If there's any similarities or whatever, move through them relatively quickly if we may.
We can do it very quickly. In fact,
okay.
we can make these slides available, and if anybody's having trouble sleeping later, they can read them. So
great information. And yeah, I would love that we can make these slides available after the
absolutely.
session. That's great.
So, and this is good. Here's the situation with these bills. They're either record keeping requirements looking for some sort of transparency, or they place nurse caps on races on rate caps on nurses. And what that means is they were either directly saying you can't pay a nurse in this position above this rate, which of course then brought the nurses out in force, and that quickly died. So what they then tried to do was say, okay, nurse staffing firm, you can't charge a facility more than, and every state had different formulas, more than 200% of the average cost of a nurse based on pricing from the previous year for a similar position. Now, forget about the flaws in trying to figure that out. What our argument always was, look, at some point, you're going to get to a place where a staffing firm is either going to stop staffing nurses in Colorado because it's not going to be worth their time, or they're going to have to push down. At some point, they're going to have to stop increasing wages of nurses, where nurses are simply going to go other places where there are no caps in place, and you're going to cut yourself out of a huge source of potential labor. We've seen that. There are 2 states currently, long before COVID, that had nurse caps in place, Minnesota and Massachusetts. And we have historically seen problems with them getting nurses. And I'm talking about, like, in Massachusetts, both of them, in the winter, February, all of a sudden we're in the middle of flu season. We forget because of what we've been through for these past 2 years, but the flu season is a pandemic in a lot of places. And you've had to have the states go and redo the caps because they can't get nurses. So we were very concerned about that with these states that were trying to put these caps in place, charging what they wanted to charge, or limiting what staffing firms could charge. So we've got these 14 bills. Some of them have passed, some of them have not. Some of them are still going on. None of the bills that have been passed or that are still under consideration have rate caps that are going to move forward. They've either been defeated, or we know they're going to be withdrawn from the bill, because we know that this is not something that is sustainable for the state. The one troubling thing that remains, that we are really spending most of our time now focusing on, is what we would call, and it's there in that Indiana slide, language that restricts employment movement. There have been hundreds and hundreds of claims that these facilities are losing nurses to either staffing firms, or they're having nurses. There's even stories of nurses walking up for their shift and checking a job board at the last minute and seeing a shift down the street, and then leaving and going down the street. And I don't think that happens very often, quite frankly, but a lot of these things don't happen very often that they're talking about. But one of the things that they said have happened a lot is that staffing firms are stealing agency nurses or facility nurses. Here's what happens, and I think probably everybody listening to this has experienced this in one way or another. Travel nurse, a per diem nurse, is working next to a nurse that is employed at the facility. In the point of conversation, talking about whatever, nurse, normal conversation, somehow the nurse that works for the facility finds out what the travel nurse is making per hour. And the travel nurse says, the nurse of the facility is like, oh my God, you're getting paid $20 an hour more than I am.
Right.
And the travel nurse many times will say, well, you should call, Nurse Gypsies and see what they've got for you, because we're always looking for good nurses. And so the facilities wanted to limit the movement of the nurses and say staffing firms can't hire nurses from a facility. Now, that goes against everything that not only, kind of most labor law holds, but really goes against what the Biden administration is pushing on the federal level, which is, let's let employees of all kinds be as free as possible to move around, to pursue jobs, to maximize their income, and to find a job that suits them best. But the hospitals are saying, or the nursing homes and everybody else are saying, except when it comes to our nurses, because we want them to stay with us, even though we know that they can make a lot more money elsewhere. Now we can talk about, how else the money could be spent by the hospitals, but that was one of the things that we were really concerned with, and we continue to fight back on. So we've got these states that are still working through these bills. Ohio is still active, Pennsylvania is still active, and that's probably going to go through the end of the year because they have longer sessions. But I think in most part now, we've started to see a adjustment in the marketplace.
Yeah.
And the legislators are understanding that. Now, one of the things that I want to talk about, Steve and Rachel and I talked about this before the webinar. One of the things that we've heard has happened to some people, some nurses, is that as COVID started to slow down, we saw a drop in demand, a pretty steep drop in demand.
Mm-hmm.
And one of the things that we saw or we heard about was we had some facilities go to their staffing firms and say, look, if we don't renegotiate the terms of this deal, we're canceling the entire contract.
Yep.
And so now the staffing firm has to go back to the travel nurse or the per diem nurse and say, look, I know this is what we agreed to, but the client is going to cancel this contract. And so you're either going to be out of a job, or what they're going to do is they're going to cancel the contract with us. They're going to bring in another firm and hire you back at a lower rate. And it may be lower than what they're offering now. Now, from what we've understood, this was very, very harsh market correction that was in place with previous contracts, and now that's kind of subsided greatly, and now you're just seeing new contracts renegotiated. The staffing firm, quite frankly, when you all work with the firm, the staffing firm should be very clear up front with you about what the cancellation policy is.
Right.
And going forward, if you all don't already, you should ask that. What's going to happen if the client halfway through this contract decides to cancel?
Right. Yeah. And Toby, I want to spend a minute on this. And again, I want to make sure we have some time at the end for questions and further discussion. But this point in terms of bringing this into the day-to-day lives of agencies and travel nurses is such an important point, because at the Gypsy Nurse, as you know, we're a resource and support community for, at this point, over 500,000 travel nurses, either existing or former, or people that are interested in travel nursing. You know, we got a massive audience in our Facebook network discussion group, in which we have almost 170,000 active members in that group. This is discussed all the time. I mean, pay has always been an important discussion point, but right now, with the climate the way it is, there's so much controversy and so much, frankly, bad feeling out there relative to the needs dropping a bit or normalizing, if you will, the rates being affected, and travel nurses, and in particular, I think it's travel nurses that are somewhat new to the industry. They don't understand what's happening and in the dynamics of what's happening. We hear things about, well, it's my rate has dropped. It must be because the agency wants to make more money, so they're reducing my fee, but they're keeping the difference. We are hearing, as you just walked through the legislative component, well, I couldn't get what I was getting before. That must be because this national federal pay cap is now in place, and I can't make as much as I used to. There's just a variety of things swirling that is market driven. It's the agency nurse dynamic. It's facility driven, but there's just a ton of information there.
Yeah, you're absolutely right. And I think, so to your point, Steve, there is no federal nurse licensing or nurse rate cap legislation pending. Certainly nothing that's been passed, certainly nothing that will ever be passed on the federal level. And again, even on the state level, even in places like California, they're even in Illinois, where they passed a pretty substantial bill, they weren't able to get the rate cap language through. So there are no rate caps in place except for in Minnesota and Massachusetts. I think this is one of the reasons why it's so important for all travel nurses to be associated with Gypsy Nurse, because they're going to keep you up to date on these things. And if you've got a place like Gypsy Nurse to go to and say, hey, I'm hearing that the contracts are being canceled, what should I do? Or what is my recourse if they do cancel my contract?
Yes.
You're going to have a forum where you can get those questions answered. And you can, make yourself hopefully not only at that point, but then going forward, again, like we talked about, when you're working with the staffing firm, ask them what the cancellation policy is.
Right.
Is there a term of 30 days before the contract can be canceled? Because that would give you the opportunity to look for something else. I will tell you that everything that I have heard, to Steve's point, these have been client demanded changes, which it's not just changes, it's I'll cancel the contract. Now, again, what we've seen in other places and what we've seen other times is a nurse, a hospital will cancel a contract that they had with staffing firm A. They can call up staffing firm B and say, I want you to come in and take these 100 nurses that were here working on a travel nurse contract. I want you to hire them and keep them here. But instead of paying them $115 an hour, what they're getting now, I want you to pay them $90 an hour. And so, you need to be aware of that. Again, this has been a huge market reaction to COVID. This does not happen all the time, does not happen most of the time. This is just something that's happened. And while I think it's subsided, I think it probably is still occurring in some places. And I don't know, depending on you may not have a lot of things you can do, but there are some things you can do, including never going back to work for the facility that does that, quite frankly. And you should tell your friends about that as well, because it's really short-sighted when a facility does that. Hopefully we're behind that and we're moving forward to kind of an equilibrium. What are our next steps here going forward now in June of 2022? We talked about on the federal level that Senator Kramer from North Dakota introduced his transparency bill yesterday,
Yes.
which calls for a task force to study the use of travel nurses, how much they're being paid. But really, the focus of the bill, quite frankly, is on the staffing agencies. There's a lot of, are they engaging in price gouging? That's one of the things the task force is supposed to look at. And one of the things that the legislators kind of logged onto when kind of facing pushback from nurses was, well, we're doing this because you're talking about public money. Medicaid's being spent in a lot of cases, Medicare. And so we're trying to, protect the taxpayers' money. So I think this task force may move forward. We're in the process of setting up a meeting with Senator Kramer to try to get in there and see really what his concerns are, what he's hoping to accomplish. Hopefully we can get him a lot of information that this task force isn't even necessary. It was also announced today that one of the things they do in the House of Representatives is they set up what are called caucuses, and they're basically interest groups of whatever. I mean, there's hundreds of them. So they set up a long-term care House caucus yesterday, in which they're going to represent the long-term care facilities needs and work to make sure that they are coming up with policies that help with mostly the workflow issue and the workforce issue, keeping people there because they have such a hard time. And it's not only nurses, quite frankly, when you're talking about the long-term care people, they've got support staff there that all of a sudden in COVID found themselves being able to go literally work across the street at Target and make more money than what they were making in a nursing home. And so not only were they making more money, but their working surroundings and their day-to-day work life was so much better. And so that's what they're looking for. As far as the 118th Congress, which will be after the midterm elections, you're going to see more of the same. In the fact, I think it's likely the House will fall to the Republicans. The Senate will be very closely divided no matter who wins control. So you're going to see, I think, a conversation about this continue. Um, I'm hopeful that the conversation starts to move toward what can we do to increase the supply of nurses,
Right.
and what can we do to make the working conditions better for the nurses, because this is the other thing we heard. And then I'm going to wrap up because I know we've got questions. One of the things that we heard constantly that we brought to legislators, and I'm sure you all unfortunately experienced this, was just you go to a restaurant, you expect different service at a McDonald's than when you go to a Ruth's Chris, right? There were hospitals that were saying, and nursing homes that were saying, if I'm paying this much money for a nurse, instead of having him be in charge of 4 beds, he's going to be in charge of 9 beds. Like, I'm going to give him twice his workload because I'm basically paying for 2 nurses. And that's really dangerous. It's unfair to the nurse and it's unfair to the patient. So we're hoping that issues like that get looked at. On the state level, we've got a couple bills left that we'll take care of. And then we'll see in 2023 how this issue plays out. If COVID remains kind of quiet and the demand is kind of leveled off, then I think a lot of the push to regulate this industry will subside. And I think the outcry of the travel nurses that are coming in and upending everything, which some of these legislators feel is happening, they will start to be educated that is not what's going on. But we'll be ready to do whatever. If things change and we need to get back in and do this, we will certainly do that again. So I think that's all I have. So I'm going to turn it back over to Steve now and see if we've got any questions that we can walk through and hopefully answer for folks.
Well, Toby, first of all, thank you for that overview. Again, we're very fortunate to have somebody with your experience and knowledge provide kind of the real deal relative to what's happening out there, because there's so much misinformation. So this, for those that couldn't make it live, as per usual, we'll make this session available on demand on the gypsynurse.com for registered members. And we'll also, with your permission, make this slide presentation available too, because I'm sure some nurses, as well as perhaps some of our agency clients, may want to take a look at this and educate themselves in terms of what's happening. But just relative to questions, I have some that obviously nurses, as you well know, work crazy schedules. So I did have some questions come in prior to the session that I'm going to kind of summarize and pose to you. I guess one of the things that we hear off and on throughout our network group is this aspect of unionization. So you have a number of different nursing associations, if you will, that are national, as well as some state level nursing associations. But A, do you think there'll ever be a nationalized union of nurses? And B, would something like that help relative to the nurses positioning themselves with the facilities?
It's a great question. I think that, it seems to have fallen under the auspice of the states, and we've seen in several of these states that there are different nurses for private facilities and public facilities. Right. And they, quite frankly, some of them have completely different opposite positions on the same issue, which is quite interesting. I wouldn't be surprised if more unionization happened. The interesting thing is the temporary nurses, by and large, our experience, they have not gravitated toward union organization or opportunities because, for the most part, they're choosing to work temporary. And I know this is a little bit of an oversimplification, but they're choosing to work for a temporary staffing company, either as a per diem or a travel nurse, because, as we talked about, it's a lifestyle issue. They want to have the flexible schedule. They want to be able to step away and not work when they want to, or work more when they want to. A lot of them are looking just to maximize their earnings, especially if they have a spouse who has, let's just make an example of a wife is working and she's got full benefits and her husband's a nurse. He doesn't need benefits, so he's going to ask for more money and maximize that income opportunity. And so you're going to see those types of people aren't going to be interested in working for a union. Right. So you could see more of a push for a nationalized union. I would be very surprised if you saw a huge uptick in the amount of temporary travel nurses that joined a union because of those factors.
Another component to that is often discussed in the group, as mentioned, is the aspect of pay relative to the dynamic between the facilities and the agencies. You touched on it earlier, but there's so much misinformation out there in terms of who's driving the rates. The If a rate changes, is that an agency issue? Is it a facility issue? Why have the rates drop, which obviously is kind of a supply and demand issue, but can you kind of summarize in a minute or so this aspect of the rate dynamic, because it,
Sure.
it is just so volatile in our group, and I think there's a lot of misunderstanding about it.
Sure. From everything we've heard, the rates are not only driven but set by the clients, and it's worked in both cases. We
The
talked earlier.
clients being the facilities.
I'm sorry, the clients being
Yeah.
the facilities.
Okay.
So one of the things that really kind of led to this initial problem was that we talked about when the ARPA, the federal money from the COVID bills, came to the states and went to the hospitals. We literally had hospitals that were calling up and saying, I don't care what it costs. I
Right.
need you to send me 6 nurses tonight.
Hmm.
You have some states, as you all know, that have nurse-patient ratio requirements, and the fines for missing those requirements are very large, especially for nursing homes where the fines run about $10,000 a day if they're not in compliance. And so it made sense to them to just say, I don't care what it costs. I need them to do this, and they've got this money to do it. There were facilities that were offering, sign-on bonuses, retention bonuses. Um, they would sign up travelers for 13 weeks, and if they made it through 5 weeks, they were paying bonuses. And that's because they needed them, and that's what they wanted to do. Then the problem happens is that the nurses get used to that, and they think that that's the system that's going to be in place, and then all of a sudden they change quickly when things start to slow down. So as much as the clients and the facilities were driving the wages up when the pandemic was hyped, they're the ones that actually then drove their wages down. From a natural business perspective, they just didn't need to hire as many nurses because the demand was down. And then from kind of the artificial impact, they went in and threatened to cancel contracts with staffing firms unless the rates were dropped. And so they really are the ones that are driving the rates. And the issue is, and if you really had to point one group out, I know we don't like to do that, but it really is the hospitals, because they're the folks that have the greatest demand and the greatest amount of money. And the nursing homes and long-term care facilities are constantly in their shadow, and they quite frankly don't have the revenue to keep up,
Right.
and yet they had to. And so you've seen some places go out of business, and that's kind of what drove this issue. But it really is the fact that at the end of the day, the rates that are paid are driven and determined uh, by the client, healthcare facilities.
Well, and that clarification is very helpful, I think, for our audience, because so much of what you hear, it's kind of agency based, and yet, many of the facilities and systems are again, complaining about some of the rates that they're being charged, and yet many of these systems and facilities had record breaking profitability for those that are for profit over the past couple of years, and yet it's some of those same systems and facilities they're saying, well, we can't afford to pay these rates. So it's just
Yeah.
this dynamic that just doesn't seem to make sense. Another item that comes up quite a bit in our network group, and I'm kind of consolidating here, but it's this aspect of, well, why agencies? If I'm a travel nurse or I'm new to travel nursing, why do I need to work with an agency? They're a middleman. Why can't I just go to the facility directly? What is the benefit of working with an agency? All they do is take a cut of my pay and that's it. How do you respond to those sorts of comments for those that don't really know what agencies do?
Sure. Yeah. Well, I think first and foremost, when we talk about education and people, kind of understanding the industry and the business, I think it's important to note that, nurses have to be somebody's employee. You have a very hard time making an argument that a nurse can be an independent contractor because they're constantly under the supervision and control of somebody.
It's a great point.
So if you are going to go work for a facility directly, you're not going to be a travel nurse. They're not going to hire you to that kind of contract. They're going to hire you directly.
Okay.
And that is certainly a way to go. But if you want the flexibility of being a travel nurse as far as where you work and for how long you work, you're going to need somebody not only to find you the positions, but you're going to need somebody to be your employer. And by that, we mean you need to have somebody that checks your credentials to make sure you're eligible to work where you want to work, that are going to remit and withhold your pay taxes, both federal and state, that are going to pay your workers' comp coverage, that are going to pay your UI coverage. Because 1099, an independent contractor, doesn't do any of those things. And while that sounds great, the fact of the matter is that if you as a 1099 have been misclassified, it is a penalty that goes both ways. So for instance, let's say I have a hospital and I have 10 nurses working for me that are independent contractors, and I get audited and the Department of Labor says these people aren't independent contractors. So now I'm going to get in trouble because I haven't done what I should have been doing as their employer. But the other thing is the nurses are going to get in trouble because they haven't been doing the things that they should be doing as an employee, i.e. withholding weekly or biweekly payments for income tax to the federal government, all sorts of other things. So the working with an agency not only gives you the persons, the entity looking to find you the jobs in places where you can work, making sure that you're qualified to do what they want you to do, and also, quite frankly, being your advocate. If you're working for any kind of staffing firm that does not stick up for you, don't work with that staffing firm.
Great point.
If you have a problem at an assignment at a hospital or a facility, you should go to your staffing firm and let them know, and they should stick up for you, and any of the good ones will.
Yeah, and that's a great explanation because here at the Gypsy Nurse we are here to support travel nurses and the travel nursing community. Our job is not to support the agencies, but we try to bring transparent information. And there's so much misinformation out there about what agencies do for you. I think it's important to note that. Because there is a lot of discussion within our group. Well, why can't I just go direct, or why do I have to work with an agency? Or there are, some kind of pseudo agencies that supposedly, just get you in touch with the facility, and you keep the difference or what have you. And I would say that travel nurses should act with caution on those sorts of situations. People that are promising a lot but don't deliver. I guess we only have a couple of minutes left here, Toby, and we've got a lot of great comments. We've got a comment from an agency. They love your explanation of the benefits and the role that they play. We have a number of other travel nurses saying, thank you so much for this information. We really appreciate it. So more supportive comments than questions, but your message is resonating. But as we wrap up here, we look at the dynamic, and we, again, with us focused on travel nurses, as we look forward and as we look at travel nurses evaluating contracts and looking to work with particular agencies, what is some advice that you can give them? So whether they're a veteran travel nurse or whether they are new to travel nursing or somewhere in between, as they go to their next assignment or they have their next contract put in front of them, what are a couple of pieces of advice you would give them to help navigate over the next few months?
Yeah, no, I appreciate that question. I mean, I think that if I were a travel nurse, I might work with a couple different agencies, but there would always be one that I really just want to work with. Your agency that you work with should be your partner. They're going to be your employer, and sure, they benefit by placing you. But any agency that you really want to work with should be looking out for you and appreciating what you're doing by going out there and putting yourself in a position of helping people. They should be willing to, and not only willing to, they should proactively do things like make sure that your credentials are all up to date. And if something needs to be updated, they should be helping you not only, find where to do it, but help, logistically making sure that it gets done. You should be able to reach them just about at any time because they're your partner, but they really are dependent on you, and they should have your best interests at heart. From a real kind of X's and O's standpoint, the cancellation clause I think is going to be the hot issue right now.
Very important.
Ask that what that is. What's going to happen if I get canceled? The other thing you're going to want to ask, quite frankly, is one of the things we saw, again, talking about, and this is not a bad thing when I say that, temporary nurses are just focused on maximizing their earnings. I think that's a great thing. I totally get that. And a lot of times what happens if a travel nurse gets sent somewhere and they're working 36 hours a week, which let's just say is 3 12-hour shifts, a lot of travel nurses like to freelance and pick up other shifts during those off days at other locations. We know there's not a shortage of work. Check with your staffing firm and find out if they allow that or not. There can be some worker comp concerns, but most staffing firms will be willing to help you find those kind of positions to kind of, you're in a new town, you're there for a certain amount of time, you want to maximize your earnings. They should be able to help you, do that. And if they can't help you do it, they should be able to give you some advice on how to do it yourself. But, again, I think working with a staffing agency that treats you not as an employee, but as a partner, and they're just as dependent on your success as you are dependent on their help. Finding that kind of relationship is key.
Great. Well, on that note, Toby Malara from the American Staffing Association, thank you so much for being with us here on the Gypsy Nurse. We really appreciate it. I mean, this is just great information. It's correct information, which in this day and age is so important. So we thank you for donating your time. We would love to have you back again. Would you be willing to come back perhaps later this summer or early fall and give us an update in terms of legislation and overview?
I would be honored. I'd love to. Absolutely.
Fantastic. Well, we're going to wrap it up here. Feel free to hang on, but Rachel, I think you're going to take it home here.
Yeah, definitely. Thank you so much, Toby. And if you guys want to reach out to Toby, we have all of his information on our website. So be on the lookout for that. You can check him out on Twitter. I know we have your Twitter. I'll put it in the comments because I don't know how to say it long ways. But we want to thank you again. And if you have any questions for Toby, just reach out either to him or to us, and we can pass it along to him. But thank you, everybody, for joining us.